Welcome to the office.
Hello.
Hello.
Hi, Melissa. Welcome to the office.
Thank you.
You're here with your husband.
Yes,
Where are you guys coming from?
from Kentucky.
Kentucky.
Mm-hmm.
What's going on?
Headaches, low back hurts. Of course, I broke my hand. I don't know if you can do anything for that or not, but this knee's already been replaced. I'm hoping this one, if maybe there's something you can do to keep that one to being replaced.
Okay.
I'd hope.
Do you have an x-ray of the knee?
I don't.
Okay.
Well, I might in that bag in there. I think I brought the paper copies of the knees before he did this. Well, that might be.
Okay, we'll take a look at it. We're not going to start on the knees today anyway.
Okay.
But we'll take a look at it. If we need to take them, we can take them upstairs too. Okay? All right. So back, neck,
Yes, I have headaches all the time.
headaches. What's number one?
Probably headaches.
Headaches. Started when?
I was looking back actually at medical records, and it goes way back to like probably teenager
Teenager, right
and
around.
early 20s.
Early teenager or early 20s?
Teenager, then early 20s. So
Started as a teenager.
Mhm.
Started when? Around when you started, when you hit puberty? Around your cycle time?
no, it would be later than that.
Later than that?
Yeah, and then because when playing softball with diving and stuff, my neck would, whiplash with that hitting the
Okay.
ground.
Okay.
And then I was in Iraq in '95 and whiplashed again.
Okay. Any surgeries?
A few.
A few?
Yeah.
Excuse me? Tubes in and out. So guys, this is her surgeries. So that you know I'm not joking, okay? That's her surgeries. There's that.
And a few others.
And a few others. What's all this? So, tonsillectomy, tubes in and out, total about 15 times, 3 C-sections, tubal ligation, tubal reversal, transabdominal. What's that? Transabdominal, I can't read that.
Cerclage.
Cerclage. 5 laparoscopies, right shoulder bone spur removal, right hand carpal tunnel, left knee arthroscopic cleanup, left ankle metal plate and 5 screws, gallbladder removed. Exploratory of bladder, stretched it and put in cocktail of medication inside. Left knee ACL replaced. You had some fun. What you been doing? This is all in Kentucky, huh? You guys be having some
Yes.
fun in Kentucky. Bladder sling, left carpal tunnel release. Interstem placed. Double umbilical hernia repair. Hardware removal from left ankle. Right foot fused bone together with 2 screws. Hysterectomy. Okay, left fifth metatarsal bone graft. Right knee scope. Torn meniscus, frayed cartilage. Right foot bone graft. Gastric bypass. Interstem replaced. Total knee. Right finger release. Trigger finger release. What's left? All right.
No, I don't. It shouldn't be too much.
All right. Can I put this away?
Yes, you can put it away. It's overwhelming.
Thank you. It is a little overwhelming. And those are based on symptoms you were going through, I'm pretty sure, okay?
Yes.
And we need to figure out where you're at today.
Okay.
And we need to find your balance point. And we need to figure out, you're obviously out of balance. So we gotta figure what we need to do to get you back in balance. Fair?
Fair.
Okay, so number 1 is headaches. It's all day, every day?
No, I'm on pain medication, so that helps, but I'm hoping to get off all the pain stuff.
Well, I don't tell people to take or stop medications,
understand.
but you'll figure that part out. Let's figure
Right.
out what we can do in 4 days that we have.
Okay.
Sound good?
Sounds great.
Sir?
Yes, sir.
Sound good?
Awesome, sir.
All right. Let's go over your x-rays. This is you. This is a picture in time. Looking at you from behind on this x-ray. This is right, this is left. We have 24 bones in the spine that move, 23 discs in between. I want you to think of this as your 24-story building. This is the foundation of your 24-story building. This is your side profile. On your side profile, we're looking at, do we have the right curves? No, we don't. We got too straight a spine. We need to have a forward curve in the neck, back curve in the mid-back, and a forward curve in the low back. Now, the consequence of that is that your low back, your foundation, takes up a lot of the slack. The interesting part is your L5 disc is really good compared to your 4, 3, and 2, which we need to figure out why that is. And let's run the posture line. She's an enigma.
I've been saying that.
That's a fancy word, guys. It means it's a puzzle. Some people are going to be like, he likes to use big fancy words. Well, yeah, we're doctors. Okay. All right, this is the back profile. Let's get to this one.
Okay.
You got some stuff in here. What's this thing right here?
That's interstim, the device, and it goes down the sacrum.
Okay.
No, sacral nerves, I think. Is that the right way?
Yep. To do what?
To prevent bladder spasms.
Ah, so it's stimulating the parasympathetic nerves in your sacrum.
Yep.
But what if I have to work on your sacrum?
It'll be fine.
You sure?
Yeah. As long as I don't, not MRI and stuff that would move the leads like that. So,
I don't know where those leads are. I gotta figure it out, don't I? This is gonna be a fun case. Okay, so that's the sacral nerves, and what if that's what we have to work on for the bladder? Okay, all right. This is you from behind, right? We said we want to look in order to have a stable building. We obviously see some deviations. You've had some good fun there. We also see some arthritic changes. This is all trying to fuse this area. It's calcific. I don't like the word arthritis. It's calcifying. It's more arthrosis or spondylosis, if that's what you want to call it. There's the gallbladder removal. There's some staples there from the bypass, I'm assuming. The stomach is there. And I don't know what these are probably your leads then. What are these?
Was that the mesh?
no, they took that out.
I took your mesh out.
Yeah.
So here's what's going to be interesting, because she got...
I'm not sure what those are. I'm guessing it's the leads.
This is going to be...
I know this
I'm trying to
part
figure
is.
this out. Okay, so these are the leads.
Mm-hmm.
But that one's not going to your sacrum. That's like hanging out there.
Probably knocked it loose again.
Yeah, because I fell the other day after I broke my hand down
Alright,
the hallway.
So check this out. Here's the wire. Goes
Mhm.
like this. Goes like that. And it's not near your... your sacral nerves are coming out of here. Maybe that one's hitting it. I don't know. Okay, no worries. We'll figure out we'll figure out what we need to
I
do.
can't tell you that.
It's all right. It's okay. You can see the whitening of the bone here. Okay, that's because it's called enuberation. There's a lot. I told you that because you don't have your spinal curves, your lowest lumbar is taking up all the slack. However, your disc is really good in your L5. Your bone is getting thicker in order to absorb a lot of the shock of your body.
Gotcha.
Okay, and we're going to come back to this in a second. I need to look at your foundation and look at the numbers and see what the numbers say. Okay, here's some answers. Of course. We have a 1 millimeter difference right now of the hip on the right versus the left. We do have some wear and tear, and things are starting to wear out on the inside of the hip sockets bilaterally. You have space on the top, but they're stiff or calcified there. Your sacrum and your pelvis, we'll talk about that. Your right side goes up and turns in, your pelvis. Your sacrum on that right side goes back 3 and down. So yes, these are old tailbone injuries that started the process here. I may be working down low S5 anyway. I don't see anything around there, so I'm pretty sure I can work on that. All right, so we said this one is whitening. You can see when I'm looking at the shape of the bone, they're curved. That means a lot of compression. You played hard, you work hard. Okay, and that's just what it is. Let's go to the...
Some of those might be the staple looking things, might be from the hernia repair too.
Possibly. This one is definitely gallbladder. This one is the stomach area. Could be the hernia as well. You had a hiatal hernia, or you had a
Umbilical.
umbilical. Okay,
I don't know.
That sounds about right.
Okay.
Right about there. Okay, then you start to curve here. There's some digestion stuff we definitely need to go over. Right TMJ. And the upper cervical wearing out a little bit, and we have a deviated septum. You have any breathing issues?
Mm-hmm.
Okay. So we got a few things to deal with. No problem. Let's go to this X-ray. Let's look at your discs and let's look at that device that's down there. You see what I'm saying? I don't see that hooked up to nothing.
That's weird. I thought there was 2 leads too.
Well, one is there. I don't know where the other one went.
Maybe when they change the battery and put the new one in.
I have no idea. If I gotta work way down here right now anyway, and hopefully that'll be okay. Hopefully. Now, let's talk about these discs. Your discs are decent. There is a little bit of low bone density, and I talk a lot about where there's low bone density, especially in females, but in everyone is digestion. This is going to be a digestion case and a foundation case. That's the way I see it. Headaches, top of the head, side of the head, whole head.
Yeah, they can be different places.
Yeah. And then I'm sure you've been taking a lot of stuff over, meds over the years, which has affected your digestion. Your disc 5 is good. L5 disc is good. 4 is a little bit less. 3 is a little bit less. 2 is a little bit less, but they're still good. L1 is good. These discs are fine here. We have some we have an old compression injury. That's an old compression fracture, right there. As we go up, still decent though. Still stuff to work with. Your discs are great in your cervical spine. We got a little bit of that reverse curve going on. Inflection. Check it out though. Inflection, everything moved. Do you see that? That one maybe didn't move, but everything moved. So, sorry, let me rewind. C2 is still tilted back. So there's a potential C2, maybe C7. Maybe. 1, 2, 3, 4, 5, 6. The interesting part is this: all your stuff related to your stomach and the nerves going to the stomach, that's all here. So that's been there for a while, okay? And I'm pretty sure that's part of why your digestion was off. Now, when was the surgery for the stomach?
In 2016.
So this is even before that. Okay. This is the fun part right here, okay? And we got to figure out kind of, I'm okay working down here. I don't know where the other lead is. Where's the other wire? Look, this one goes here. This one disappeared. Am I tripping? Am I hallucinating? I don't know.
I honestly don't know. I've never seen it like on a x-ray like that.
Okay. But you see what I'm showing you, right?
Yes.
I didn't see it from the side view either, where the second one might go be.
Let's go ahead and get started. Let's see what we find on the exam. What I'm thinking is digestion and foundation, parasympathetic, rest and digest. The nerve going to the wrist is coming from the base of the neck here. And you said there was a fracture, right?
Mm-hmm.
So we looked at the x-ray. It's in opposition, so it's healing okay, but I'm sure there's pain there. I can work on your neck, your shoulder, your elbow. I can even work on your wrist for it.
Okay.
Okay? But we're not touching the actual finger.
Not gonna pull it and pop it, huh?
I ain't pulling it. No way. No, ma'am. That's the wrong channel. All right, so let's go ahead and put your x-rays up this way. Let's go ahead and examine you. We're going to go ahead and put the blinds up. Let's get started. We got a whole family back here, don't we?
Yes.
We got all the puppies and tigers. What's that? And then we got something going on down here. So she had the devices implanted right here. Okay, is it okay if I just put this here?
Yeah.
Okay, so the device is planted right here, supposedly stimulating the sacral nerves. I don't see where they're going, but let's maybe with an MRI you'll see it. If I need to be down in the sacrum coccyx area, I'm going to be on the left side. You can lay on your right side, right?
Yes.
Okay, then we're fine. We're fine.
Yeah, I can lay either way.
And then hubby got a good story for us too, doesn't he?
Yes, he does.
And we can thank Jason Statham's doppelganger.
Yeah, he's a mess.
Starting at the base of the neck, let's see what we find. Of course that honking horn out there is going to be going on right now. Wah, wah. And the first thing we're getting is T5, T6, left side, 10 points. Thank you. Of course it's going to be down in her sacrum. It's down in the low. S5, S4, left side. All right, let's check up top. Head down, please. And 10 points C1, left side. Let's do static palpation, please. As we're doing static palpation, Mama Tiger's getting a little nose job right there. Static palpation, you can see the edema pools right there. You doing okay, ma'am? Tender right there. Yes,
Yep.
ma'am?
Yes.
She ain't gonna freak out over there, right?
No,
No.
All right,
no, she's good.
right there. 1, 2, 3, 6, 7, 8. T6, and we got a puffy sacrum. We're gonna check the hips, feet together, scoot forward so your feet are touching the floor, feet together, open and close the knees with your feet touching, open and close. Right side only, please. Good. Left side only, please. Right side. So when she does the right, the left shifts, do the left side. When she does the left side, the right side is actually, it shifts as well. Scoot back for me, please. Now the front part. Back slowly in extension. This is L5. Tender.
Yep.
This is S1, S2, S3, S4,
Yep.
S5. Yes. Yes?
Yeah, that fell over here.
You felt it to the left side. One more time. L5. Tender.
Yes.
S1. S2. S3.
Yep.
S4. S5.
Oh my God.
S5. Coccyx to S5. I'm on the outside. I'm on the outside in the coccyx.
Okay.
Coccyx
Okay.
to S5. Sorry, ma'am. I have to make sure we.
Whew.
Yeah, she played hard and worked hard. Softball was her life.
Softball?
Softball
How many
was-
years you play softball?
30,
What was your position?
second or third.
Oh, so you got an arm, huh?
I also raced
Yeah.
motorcycles before that.
Of course.
Of course you did. Head down, 2-stroke, 4-stroke, dirt bikes.
She was dirt bikes when she was, what, 6, 7, 8?
Between 8 and 12.
No, 8 and 12.
Right there. More tender there, more tender there.
I think that
That one more?
one.
Yeah, 7. 6, 5, 4, 3, 2, 1.
Holy crap.
Oh yeah. C1, T1, T6,
Man, he
S5
put
coccyx.
his thumb right in that spot. I'll tell you that hurts so bad.
Game plan. Okay, so what we're gonna do, we're gonna work on C6, T1, sorry, T1, T6, C1, and sacrum. Now, out of those, we need to decide what's the most important. T1 and T6 are gonna be sympathetic nerves, and C1 and sacrum are gonna be parasympathetic. So I think in your case, we need to kind of stick in one system, right? The question is, which one do we start in? We can do either one. So the book says sometimes to clear the sympathetics. That would be T1 and T6, which would be this one and this one. However, I want to work on your foundation. So my thought process, and I'm off tomorrow, right? So we're gonna regroup on Wednesday. So my thought process is, let's do the foundation and the neck, the upper cervical.
Okay.
Have you walk, see what happens. Hopefully that clears up the mid for today, okay?
Okay.
After that, I'll work on your feet, I'll work on your shoulder, elbows, and the wrists. Fair enough?
There.
We're gonna wait on the TMJ and jaw for next visit.
Okay.
And the reason why is you've got a lot of stuff going on. And no, it's about healing potentials, right? You know, we talk about this a lot, and you know, the more you adjust, and you'll see in visits I do a lot of adjustments.
Yeah.
But the idea is, right now, we need to get that power on. I need you to see a difference, and I need us to know what made it, the difference.
Okay.
Does that make sense?
Yeah.
Okay. All right. Sir,
Yes, sir.
you ready?
He's like, take it away.
All right. All right.
If
Let's
it,
do
whatever helps her, I'm all for it.
Sit back for me and let's start on the neck. Scoot your butt back a little bit. There you go. Showtime. Hi, Shasha.
I have butterflies.
So we have C2 on the right, C1 on the left. C2 there, yes?
Yes.
C1 there. I'm not going to go harder than that. We know what's
Okay.
there. Okay. Now let's do seatbelt. Right hand up. You okay with that?
Mm-hmm.
Just make sure it's okay on your chest.
Yeah, that's good.
Okay. So people talk about the Y strap adjusting. I don't know too much about it.
Yeah.
So I don't really comment on it. Now, C2 we're going to set as a PLI. I'm on the right lamina of C2. And we need to set, let it drop. Oh wow. Wow, drop it down. You've been getting your neck twisted a lot, haven't you? Drop it down, down. Drop. Nada. Drop it down. It's not moving. Let's go on the other table. That thing don't want to budge. Face down over here, please. All right, you ready? That thing don't want to budge.
I know. It hasn't for a long time, especially this side.
Let's figure out why. This is gonna be fun. Slide up a little bit, please. I just need a little bit on there so I can continue. C2. That's a piece. Turn your head to the left, please. Did I hit your chin on that, ma'am? Chin's okay. Turn your butt towards me this way. Left hand up over here. There you go. Got a piece. She's bouncy. Okay? Come off slowly. Now let's walk it off. Walk once.
Toes are popping.
What's that?
Her toes are popping.
Come back over here and have a seat. Let's recheck. See what happened. We got some fun. You're gonna have a fun week. It actually cleared, but it didn't crack. No kidding.
See, I didn't hear it pop.
It didn't crack, but it cleared. That's weird. Huh.
Famous last words from every doctor I've been to in my whole life.
Let's continue on down low. Let's go right side down, please. You sure you're okay on that side, right?
Yes.
Cool. Let's bring this forward, tuck forward. There you go. When was the last time you got adjusted?
Probably about 6 months or so ago.
6 months ago.
Mhm.
Be on the outside underwear. Is it okay if I push on the shoulder?
Yes.
Okay. You feel that one right
Mhm.
there? There. Right there. It's just light, okay?
Mhm.
Relax the shoulder. It's a little bit. Come up slowly and let's go back over here.
Not cooperating, am
It's not that, it's your spine is really bouncing, and that's ligamentous, that's nutrition.
I? Okay.
Bad nutrition?
That's bad nutrition. So we're getting it started right now. So the device is here, right?
Mhm.
That's it, and it's going there. There's nothing here though, right?
Mm-mm.
There's nothing there. What's that? There is something there.
I don't know.
There is something right here. It's coming from here. It's going there. I can't mess with that, dude. Come here, let me show you what I'm talking about. So, I want to be on S5.
Right.
Okay? But look, feel this. Lightly. What's that? The wire's here on the right.
Right.
Alright. Remember I said that other wire, something happened to that other lead, right? Where's the other lead? There should be 2 leads, right?
I guess so.
I know she,
Honestly, I don't know.
she used to have the old device before the battery went out, and it had a couple leads on it.
Is that tender right there?
Yeah.
Let's work on her 5, okay? We'll come back to that. I may need to take another x-ray to see. Drop board. Sound is the board. Make sure she's okay over there. Alright, we're gonna do L5 to start. Nice and easy. Oh, that was nice. That moved.
Yeah, it did.
That moved nice. Let's get a little more. There you go. That L5 moved really nice. Nice. Now, let's come up slowly and have you walk it up. Step away from the vehicle, ma'am. Just walk it out.
Okay.
Walk it out. That should be a little different already.
My knee popped that time.
What's that?
My knee popped that time.
Well, as we're making changes to your foundation, things will shift around, okay?
Mm-hmm.
As you're walking, tell me if anything is different right now. Doesn't matter good or bad.
I'm not getting dizzy when I spin around and walk back.
Okay. Back over here and have a seat.
I
Let's
tend to do
retest.
that a lot. He says I do it when I'm driving too, if I look over my shoulder.
You get dizzy?
No, whichever
No.
direction she looks over, she tends to veer that way.
Oh. Interesting.
It makes
That's
for an
the.
interesting
Has
ride.
she's had her ears checked.
Yes, sir.
She had tubes put in.
Yes, sir.
When were the tubes put in?
All the tubes were like from the age 3 and below,
Got it. Okay.
but I have been recently because something was going on with my ears, and they checked them, and I'm not hearing like the really high sounds.
Got it.
And then that's when he told me I had the TMJ, because when he was pressing right there or whatever, and he shot pain everywhere.
Check this out. I need to work on the base of your neck. I will work on the C7. Check this out though.
Something hot.
A little different.
Mm-hmm. A lot different.
I'm gonna go back down low, okay? Tell me.
It's not bad at all, like it was. Just tender.
The enigma. That was L5, and that seemed to help your sacrum when I thought we were gonna go on the sacrum. But then it looked like there was a wire there that
Yeah.
we're not messing with. So, let's go to the neck now. Let's get some power to your wrist.
Okay.
Sit back for me, please. There we go. Right ear. Right ear down. Come on. Drop it down. Drop. That's a beat. Right here down. Let's go face down over here. She gonna make me work this week, guys. That's alright.
I'll put her picture next to the enigma in the dictionary.
Slide up a little bit. Nah, she'll be fine. Just gotta get it moving. There you go. Now, let's walk that off one more time, please.
Keeps me in. Oh, I said, now my foot popped. I'm like, golly.
It's not a bad thing, don't worry.
Don't
Don't worry.
Maybe it's getting everything back in place.
Have a seat. Let's retest the neck. Let's see. It's clear. It's clear, but there's no crack.
I know, it's like, ugh.
All clear. May I continue?
Yes.
Ears. Shoulders. Let me do the work. Let me do the work. Down. There. On your back, please. Raise your right leg. Down. Left leg up. Down. Sit up, please. We're going to work on the elbows and the wrists. Stand over here, please.
I can take this off if I need to.
Please. All right, so we're working on the elbow. Relax the elbow. Distal radius. Ulna. Drop the elbow. Let's use the board. Can you go down on your knees and put your hand on there?
Mm-hmm.
Safer. Quicker. Good?
Mm-hmm.
That's Hollywood. You okay there?
Mm-hmm.
One more. Move it. A little different.
Mm-hmm. I can squeeze my hand tighter too.
Stand up front, please. Okay, let's check this out. Something popped.
It did.
Relax there. That's it. Squeeze my hand. Squeeze my hand.
Okay.
Sorry, you squeeze.
Pretty good for a broke hand.
You have good power there. Let it go. Okay. Put your wrist wrap back on. Have a seat over here. And let's. I will start on your TMJ there.
Okay.
Look up. Slowly open. Open, open, open. Slowly close. So she's got a double. Open slowly. Left opens first, right compensates, left compensates. So we got to do left, right, left. Open all the way. Slowly close.
Ah,
There you go. That's it. That's it.
I don't know how slow that was, but.
Kentucky bourbon.
That's what I need right now.
Seriously, I'm joking. That's what I'm saying, though.
She's like, yeah, I'll take it too long. I'm gonna go see.
Stand up and walk it off, please. As you're walking, tell me if anything is different in terms of your walk, your back, your hand, your head. You feel better, you feel worse, you feel like passing out.
I just feel heart is weird,
Different.
different. Maybe
Okay.
that's it. I did think I just got dizzy though. Did I stutter step then?
You kind of.
Veered?
Okay. You're all set for today, ma'am.
Okay,
Welcome to the office.
thank you. I appreciate it.
You're welcome.